Today I'm going to talk about screening in prostate cancer. It's a controversial subject. It's been debated in the last 5 to 10 years comprehensively in international media. The bottom line is, when do one has to go for a prostate checkup, and who specific is at risk to have prostate cancer? Now, generally speaking, African Americans have got the highest incidence of prostate cancer in the world, followed by Caucasians. Also, people with a genetic or a family history of prostate cancer is at risk. And those kind of people that we generally thought would need to be screened on an earlier basis. In the past 5 to 10 years in the USA, screening has been stopped, but for those two already mentioned, and that led to some more debate. So what basically happened, people from the age to 40 to 53 was considered to be at low risk for prostate cancer and did not go for screening tests. From 53 to 69 was considered the highest time zone or period of their lives where people had some benefit by screening for prostate cancer, and they were more regularly screened. From the age of 70 and older, the issue of life expectancy has come into play, and one had to consider, if the life expectancy was less than 10 to 15 years, whether you should have prostate cancer screened, yes or no. This led to a discrepancy in a sense that a lot of people, or some people, were misdiagnosed or underdiagnosed in a young age group, where people presented with metastatic or advanced prostate cancer who could have been picked up by an earlier screening test. Logistically, you need to do about 1,000 screening checks to save one life, which actuarial or financially doesn't seem to make sense. But for a patient sitting in front of you that wants his prostate to be checked and sorted out, that doesn't make any difference. So we changed that approach. So basically what we recommend these days, that one should go from the age of 40 for a baseline checkup, a rectal examination and a blood test, that's all, nothing more than that. If your PSA level is less than 1 or even less than 0.6, and you don't have a family history, or you don't come from an ethnic group with high risk of prostate cancer, you can have it rechecked in about 4 years' time. If your PSA is 1, or you need to check it in another 2 years. If your PSA is higher, I think you should check it on a yearly basis. There's good work done that show the PSAs of 3 to 4 levels below the age of 50. A high percentage of those people actually do develop prostate cancer at some point in time. Above the age of 70 to 75, if your PSA level at 75 is 3 or less, and you don't have any symptoms, you can stop screening for prostate cancer. However, if you do have any symptoms and your PSA level is higher, then screening should be implemented. The advantage of new techniques like MRIs in prostate cancer has negated the effect of unnecessary biopsy. So even if screening doesn't make financially sense, it's a fairly cheap examination compared to unnecessary biopsies if you include MRI and other diagnostic procedures as well. Basically, because prostate cancer is the most common cancer, has become the most common cancer in the United States, surpassing colon and lung cancer as of late. It has become, and the cost of research and treating those patients has become so enormously. I think screening is here to stay and will be fine-tuned in the years to come.